Welcome back to Morning Coffee. I'm Jim Cuccinata. It must be Tuesday. We are having our Halo Health segment. I am very excited because we brought back Dr. Eck. We talked to her about a month ago, and we were discussing this great bill that was kind of stalled in the state of New Jersey. And Dr. Eck wanted to come back today to give us some awesome news. Welcome back.
Hi, good to be here.
Yep. So I teed you up. What's the awesome news?
Oh, well, the news is that they came out with the new bill, the initial bill, repealing and replacing Obamacare. And I'd be happy to just talk to you a little bit about that.
Absolutely.
I think that it's Obamacare light, and
Okay.
they really need to work on it to make it better. They're going to keep a lot of the aspects of the Affordable Care Act, which were popular, but not necessarily a good deal for the people or the taxpayers. And one other thing was to keep the children on your plan until you're
Right.
26, and the other was to not discriminate against people with pre-existing conditions. And the thing I would say about that is, you force insurance companies to take people with pre-existing conditions, the tendency will be for people to wait till they get sick,
Right.
and they won't be able to be turned down. And that's what has driven up the cost of Obamacare tremendously, and that's why I think a lot of the insurance companies are pulling out. It's just way too expensive. But the other thing is that they're going to remove the mandate to buy insurance. Well, if they do that, and it just takes, that makes another reason why Obamacare is going to totally fail.
Right.
We really need to work on this and make it better. And I think the federal government needs to just kind of pull away and not make mandates on insurance.
Okay.
But instead, we need to just have common sense, good insurance, using real insurance principles. But the important thing is that they have to keep their promises and abide by the contract, so that if you do get very sick, they can't drop
They
you.
can drop you.
Yeah.
Excellent. We need to take a quick break, and
Okay.
we will be back to Morning Coffee after these messages. Welcome back to Morning Coffee. I'm here with Dr. Eck, and we're talking about the new version of the Affordable Care Act. And we said that the new plan was rolled out this morning, and it seems to be kind of, quote, Obamacare light, and there seems to be some issues with it. In your opinion, what are some ways that it can be improved?
Well, I think that we need to reduce the federal input into what health insurance will cover, and then we need to reduce all of the federal mandates on insurance. And I would like to see people be able to buy the policy they want from the state they want with the coverage they want and with the deductible they want. So it would be the price that would be much more reasonable.
Right. And that's the key, right? At the end of the day, you have policies that are overpriced that then get a subsidy.
That's right.
If you qualify for it. Well, it would be better off, right, in free market, is that you have an affordable price to start with, and everybody stays out of it.
And so you don't need a subsidy.
Exactly. If family care really should only cost $500 a month, it only costs $500 a month, not $1,000 and you get $500.
That's right.
It's not going to ShopRite for a can sale.
Insurance companies have gotten into a certain amount of mischief, I think, and this preferred provider organization that they have say, you need to go to one of our preferred providers. Well, that might guarantee that you pay more for that doctor or that service or that lab. And that doesn't make any sense.
Right.
Especially if you have a high deductible. If you have a $10,000 deductible policy where you have to pay the first $10,000 of services, you could really be getting ripped off. I have an example. Somebody went to the emergency room, and in a day of services, the price was about $12,000. The PPO, Preferred Provider Organization, lowered it to $10,000.
Okay.
But if you looked at the actual bill, labs were $3,500, and I looked at the actual labs that were done, and they should have been for about $100. You could have gotten on the outside.
Right.
So wait a second. And then they say, well, we have a contract. You have to pay that $10,000. And that is totally unfair to the person who is paying for the insurance.
Right.
So, that kind of stuff has to stop.
Absolutely. It needs to, healthcare needs to be more like traditional consumerism.
Absolutely.
Right. If you go to Quest or LabCorp and they say that a basic panel study costs $100, well, it should cost $100 whether you went there directly or whether
your insurance
paid for it.
That's right.
Right?
There's a lot of mischief that has happened.
Sure.
And ever since the government got heavily involved in healthcare, The people who benefited the most are the CEOs of the insurance companies and the hospitals, who are making 7 digits
Right.
in their compensation. A huge amount of money that's just flowing into these hospitals and insurance companies. I think that really is where part of the problem is. The
Right.
big money that has.
Absolutely. I was actually reading an article about that they said that there's been a shift, and most hospitals and health systems used to be run by doctors or at least health care focused people, and now it's a business that's run by MBAs.
That's right. It used to be that a hospital would be run by perhaps a surgeon who was recently retired, who knows the whole hospital, knows the people, and they would just they'd run it, and they might make the same as a surgeon normally makes.
Mm-hmm.
But now it's become just big business and huge money flowing in, and the bottom line is the bottom line. That's what they care
Absolutely.
about.
And part of it too, right, is when you have a large organization that's generating a lot of money, it adds complexity and layers and standards and protocols that kind of.
In the past 30 years, the number of doctors has doubled. The number of administrators in healthcare has increased by 3,000%.
Right.
Huge difference.
Sure,
I mean, that's who we're paying.
Yeah.
That's who we're paying.
And it's funny, if you think about manufacturing, right, they have a term lean manufacturing, and basically the theory is if 5 people can do the job, you don't need 50.
Absolutely.
Right? And in healthcare, it seems like we're going the opposite direction, where if 5 people could do the job, well, 500 would be much better.
That's kind of what they're thinking. And what we want to do is get back to the private patient-physician relationship, where the doctor and the patient are just working together.
Right.
Generally, it's where the patient can pay the doctor directly. And when you eliminate all of that bureaucracy and all that insurance nonsense, the price is unbelievably reasonable.
Absolutely. The doctor gets the doctor, right?
Mm-hmm.
Because we know today the doctor doesn't doctor, the doctor data entry.
Absolutely.
And data inputs. And the patient actually has a relationship with somebody that they can actually let them know what's going on.
That's right.
It's very intimidating as a consumer of healthcare to sit with my doctor who is rushed. Very
That's right.
nice. Love the doctor, but he's rushed.
That's right.
And he's seeing 6 to 12 people an hour, and I'm kind of healthy. So when he says what's going on, I usually have nothing. And then I walk out, I get in my car, and I've had this lump on my leg for like 6 years. I should have talked to him about it. But you don't have that time, right? Because you're rushed, because they're rushed. And if you get back to that, maybe you only need to see 4 patients an hour, or 5 patients an hour, and spend 10 to 12 minutes.
Sure, you need time to really get the story to what the symptoms are, and then to do the examination. And you can't do that in 5 or 10 minutes. There is a new trend that's going out called direct primary care, where doctors are paid, say, $50 to $70 a month to be available by email, by phone, or by visit. And then when you actually come in, the visit's covered. And it winds up being a very good model. You're eliminating the middleman. It's the patient paying the doctor directly. It's almost like a membership.
Right.
But it is working very well for doctors, very well for patients, and it's a trend that needs to
keep going. Absolutely.
Keep going.
When we come back from break, we'll talk more about this. This is Morning Coffee. This is Dr. Eck. I'm Jim Cuccinata, and we'll be back after these messages. Welcome back to Morning Coffee. I'm Jim Cuccinata. Today I'm talking to Dr. Eck, and we're talking about the changes proposed for the Affordable Care Act. We talked a little bit about how things work if you can afford your insurance, but what happens if you can't?
Okay. And that's where Medicaid has come in, and 20 million people have been added to the Medicaid roll since Obamacare was initiated, and that's considered a great progress by the government. However, I don't think it's really that good in that people don't have access to primary care.
Right.
They call an office, and most of the doctors don't take it. So I think the better solution would be for the federal government, instead of having this huge bureaucratic program where the federal government pays some, the state pays some, and the people get the care for free, instead, why don't you block grant all that money? Totally, in New Jersey, we're spending $15 billion on Medicaid, federal and state. Our whole state budget is $34 billion, to put that in perspective.
Right.
Huge amount of money. And we don't even know exactly where that's going. Why don't they grant the money back to the states, block grant it back as one big block of money, and then let the states innovate.
Right.
And that's where our idea of S239 would be a huge benefit to the people of New Jersey. S239 would say, okay, doctors are going to donate their time instead of being paid for charity. And they donate their time in a non-government free clinic. And then after they do that 4 hours a week, we want the state to simply protect us from malpractice in our private practices. So instead of socializing medicine for the poor, we want to socialize the liability
Right.
for the physician. Thank the doctors, protect the doctors, and the doctors will provide care for free to those who need it.
Right.
And you might say, well, then the doctors really aren't going to be held accountable. Well, yes, they are. Every year they have to get re-upped to
Sure.
keep this malpractice insurance in the clinic by the federal government. So that same process that the federal government uses to vet those doctors will continue to be used. And if a doctor winds up being somebody who really they don't want to be subsidizing because they're not practicing good medicine, they get dropped from the program.
Right. There's a
That
built-in check and balance.
That's right. I mean, it really does work,
Right.
and it would save a huge amount of money.
Sure.
There's a study came out today. $1.9 billion in Medicaid fraud was uncovered in all the states. $1.9 billion. Okay, fraud. It's just people billing for things that aren't really being done, or
Right.
overbilling, or whatever. And there's not a lot of checks and balances on that. So
Sure.
money is flowing out, and I think there needs to be more accountability. With S239 here in New Jersey, there would be no fraud.
Right.
Because there's no money coming out of Trenton to pay anybody. Instead, it's all nonprofit clinics provided by charitable donations, and then the doctors aren't being paid, so they can't game any system. Instead, they're just donating the 4 hours a week. That's the only thing that they could
Sure.
think with.
Right. And if you're going to cheat your 4 hours, then
Then okay,
you got issues.
that's issue. But then that should be much easier to control than all this money that's been flowing out.
Absolutely. And we were talking a little bit earlier. The health system should love this, right? I mean, think about it. A health system now has a way to offset their medical malpractice insurance costs and give back to the community and keep people out of the emergency room.
That's right. Essentially, the doctors aren't paying that huge amount for malpractice. They could lower their fees, and that's what would probably happen because they're going to be competing with each other.
Right.
And when patients are paying directly for care, which is what I would love to see, the prices are going to be just about right, just like in any other industry.
Right.
So I think that would work. And then, yeah, we're just having the state protect us. We'll get the job done. And then we'll pick up the phone. Somebody needs to have their knee operated on. We call the orthopedic surgeon. He says, okay, it's part of my 4 hours. I'll be happy to do that.
Right.
And we'll just take care of it. Hospitals would still have to be subsidized in some way, but that's the way it was before we had Medicaid. So if there's a charity system, the hospitals then just announce how many patients that they saw, they keep records, and then the state could provide that. But it would be a whole lot less than that $15 billion, I promise.
Yeah, definitely. It would probably be a 50th of it.
Or something, yeah.
Yeah,
I mean,
it would be a huge dollar number.
Yeah.
But it would be a small percentage of the total dollar number.
And
that's being spent.
essentially, a lot of that money then should go back to the taxpayers.
Right.
So that people thrive more and they can take care of themselves and wouldn't need Medicaid because there'd be more jobs.
Exactly. And if you think about it, if you're opening all these clinics and they are done by charitable donations and they need to be staffed, there will be an opportunity to pay people for front-end staff. You know, you need an office manager, or you need a receptionist or somebody like that.
Because our Health Center, we pay 2 part-timers, and the rest are all volunteers.
Yeah.
And so therefore, we don't have to raise that much money to keep it going. Our whole budget is $65,000 a year.
Okay.
And we just see about 300 patients a week or a month.
Okay.
And it's so $15 per patient.
Yeah, the math
that's all it
works.
costs. I mean, I tell you, when everybody volunteers, it's
Right.
a huge benefit to the community.
Absolutely.
And it's all local, and then people are helping their neighbors, and we're helping them with food and clothing as well. And it's just a way to be a community again.
Absolutely. And that's the key, right? We talked about that the last time. The community-based is the
That's
key.
right.
That's where it has to go. I got the hand over the neck motion. So you have your second annual tradition of staring into the camera and giving your message. And we'll do that and then wrap up the show.
Okay.
Excellent. We ready for that camera? And we're all set.
Okay. Hi, my name is Dr. Alieta Eck, and I run the Zarephath Health Center, which is a non-government free clinic in central New Jersey. I also am in private practice, where it's where I earn my living. And we have the bill S-239, which we're trying to promote here in New Jersey, where doctors would donate 4 hours a week and get medical malpractice protection provided by the state for their private practices. It would bring the communities together. Doctors would be providing free care, and instead of the highly bureaucratic, fraud prevalent Medicaid system, we would have real charity return, and I think it's the way to go. I think with the repeal of Obamacare, this is the way we are going to be able to take care of the people who can't afford to pay.
Awesome.
And if you go to
Yes.
njaaps.org, you can learn more about it. Thank you.
Excellent. Sorry about that. Thank you for being on the show again. It was great to see you.
Thank you. Yeah.
Can't wait for you to come back. I know we actually had a different topic we were going to touch on, so we'll have that for the next time.
Okay.
I'm Jim Cucinato. This was Dr. Eck, and thank you for watching Halo Health segment, and we will be back to the morning coffee after these messages.